correction from I say. I'm the division director of addiction medicine services and behavioral health department. We don't per se have a substance use director, but I'm the it's part of our behavioral health department. Substance use and mental health work together now, so has its different divisions. And I'm over the addiction medicine division. So that being said, so I'm gonna move on to our presentation today. I'm gonna focus on substance use services in addiction medicine, what we provide. So if I am challenged again here, Jen, this does not work. So bear with me for 1 second as we share the slides with you. Okay. Sorry about last minute technical difficulty with technology here, but we'll get it going. I'll do this.
I'll change this for you.
If it works,
Oh, there we go. Okay, got it.
Okay. All right, so again, this presentation is about addiction medicine services in Santa Clara County. In this division, we are providing narcotic treatment for the residents of Santa Clara County. So you might have heard the term NTP, that stands for Narcotic Treatment Programs. And those are the clinics that we manage. That's the we have 4 NTP clinics, but specifically we have 3 are located that are managed by our own county staff, and then we have 1 contracted provider. These are clinics that are located geographically throughout our county. We have 1 in South County, 1 in North County, 1 in east side of the county, Lexington Health Center, and then 1 in the Valley Medical Center called Central Valley Clinic. So those are our clinic locations. We are CARF accredited clinics, which means that we have accreditation certified by accreditation entities to be able to operate. Like, JACO is for hospitals, JACO also is for NTPs, but we have opted to go with CARF, which is another entity that provides certification for the clinics. Our clinics are staffed by board certified addiction medicine physicians and licensed clinicians. And those are our licensed clinicians are made up of MFTs, managed family therapists, licensed clinical psychologists, social workers. And we have obviously a team of nurses working with us, a group of physicians, group of support staff, and counseling team. So we're a multidisciplinary team providing this service. So in a nutshell, medication assisted treatment program offers treatment that is has medication with it. Along with this component of counseling. The medications that are currently approved for treatment of addiction, opiate addiction, I should say, or methadone, Suboxone, and naltrexone or Vivitrol. And I will get to that, each one of them in a second.
Technical.
Okay. I'm sorry that I have to pause here for a second as they're uploading that. Yeah, that's fine. Okay, so the three medications that are available for treatment of opiate addiction are those three: methadone, buprenorphine, or Suboxone, and naltrexone or Vivitrol. Those are the injections that's available. Suboxone also have now injection form available that's called Sublocade. So all these three FDA approved medications are available in our clinics, and we are happy to start anybody who are the right candidates for the treatment of these. So how do you get in? Usually you call the gateway, and our now code we are changing it to call center. And I have to, that number that you see on the screen is the gateway number, which will transfer to the call center. But the new behavioral health call center, now the two have merged, is their number, I believe, is 800-706-0900, which you can call, and you will be directed to the right clinic based on where the patients live. We try to match it to the closest clinic. You can also come as a walk-in any day except Fridays to be screened by our physician. And if the patient meets the criteria for admissions, then they will be admitted on the same day and can get in. We do have, as I mentioned, those three clinics here, and then one in the North County. It's managed by BART, and that's closer to San Mateo, but Valley Medical Center Clinic Central Valley is our main hub. And then we have the Alexian Clinic on the east side, and also the South County Clinic in San Martin. Okay, so what do we provide as an outpatient services and addiction AMT department? We provide individual counseling, which includes assessment, treatment, discharge planning. We provide case management, and we provide group counseling. So the regimen is that you get started, you get assessed by a physician, and if the patient's the right candidate, the right medication is provided. And methadone, when you start off, it's and also Suboxone could be on a daily basis. So patients come in daily to get dosed. And then as per regulations, because Title IX regulates the treatment of methadone, and Title IX is, as you may know, is a state mandate that we have to obey by. You have to come in every day and get your dose till you earn what we call steps, or that privileges for take home. So the take home privileges could be depending on how soon you earn it, after 30 days, 90 days, and 6 months, and so forth, in terms of how well the patient is doing with the treatment plan. Are they not using any more drugs? Are they working and involved and doing something good, per se? And if that's the case, then they will earn steps or take home medication. So you don't have to come daily. But to start off, often it is a daily dose. So we are open 365 days of the year, our dispensing. So the clinics are open at 6 a.m. for that purpose, because a lot of our patients do work or go to school and etc. So we wanted to make that daily dose available before they get to school or work, etc. So that daily dose starts off with that, and at least they have to get 50 minutes or 60 minutes of counseling each month. That's again a state mandate, but often we obviously offer more than that in the hopes of to stabilize them. So that could be individual treatment, or it would be in group, and it could be up to 200 minutes of counseling per month per state regulations. So the treatment could be very individualized depending on the patient's need. It could be, I don't know, they come twice a week for a individual in a group, whatever they can make a commitment. We will honor that and we work with them. But at the minimum, you need that 50 minutes up to 60 minutes of a month counseling in order to stay in treatment. We also provide perinatal substance abuse program, and that's services available for patients, for women who are pregnant and struggling with addiction. And we provide medication to that cohort as well, along with counseling, case management, health education, health exercise classes, nutrition, parenting classes, etc., in order to make them to deliver a healthy baby. That's our goal. Or we also take women who are struggling post delivery and up to age of 5, children for that purpose. And we offer childcare for those patients who come to our clinic because it is a more intensified treatment that we keep them 3 or 4 hours in the clinic by seeing the physician, getting health education, getting counseling. So all of that adds up to a good 3-4 hours at a time. Therefore, if they need to have childcare, we provide that childcare on site. We also provide transportation. We go pick them up and bring them if they don't have transportation. So again, those are the what services we have for PSAP, methadone, Suboxone treatment, counseling, childcare, case management, coordination of care with the OBGYN provider and NICU. And we also have a substance use counseling team available and with the OB and the NICU. Aside from our 3 clinics that I mentioned, or 4 clinics per se, and the perinatal substance abuse, we also offer a specific treatment modality for youth who are struggling with opioid addiction. This is somewhat of a new service that we have opened up the last 2 years or so. And this clinic is offered at the Alexian Health Center, and we treat ages 12 to 21 in this clinic, and we have a partnership with our VMC pediatric unit. So anytime a patient could walk in at any time during the day or night, and they can come in through emergency room or direct admit to the pediatric, and they get admitted, and then they get started on Suboxone. Our choice of treatment for this age group is primarily Suboxone. So once they get induced to this, then they get discharged. If they come through emergency room or the pediatric unit, then they get connected with our addiction medicine physician that's an adolescent youth psychiatrist and addiction specialist. They see them at the youth opioid treatment program, and they carry out the treatment throughout the outpatient services. Along with that team is counseling that's provided with our family children services, and we have peer mentor that will also be working with them. We have case manager working with them, and we have psychiatrists. So it's a team effort. And purposely, we have put it together so we can provide services to each of these youth that are struggling with addiction or mental health issues, and deliver the care they need along with additional support. And all along with, as we go through this, we also do care coordination with their primary care. In addition to the specialty clinics, we offer medication-assisted treatment inside the emergency room. So all three hospitals that are owned by Santa Clara County, the Valley Medical Center, O'Connor, and San Luis, they all offer Suboxone treatment. So anybody struggling, they can walk in anytime at the emergency room and get started in services, and then we connect them to outpatient services for ongoing care. We also provide medication-assisted treatment program at the hospital, at the inpatient. So if somebody gets admitted at a hospital and they have addiction issues, opiate treatment is available. They can get started at the inpatient, and they can get connected to outpatient upon discharged. And I am very happy to say that our program with the inpatient has been part of honor roll throughout the hospital system that are providing opiate addiction treatment program inside the hospital. We also do medication-assisted treatment at primary care. We have trained number of our primary care physicians at different locations, for example, at Moore Park, at downtown Sunnyvale, Milpitas, on medication-assisted treatment program. So you don't have to come to any clinic. Your patient, if they're there, they can talk to a provider there who provides this care, and they can get started there. And then sometimes they come to us, and then if they're stable enough, then we transfer them back to the primary care clinics, and we also provide consultation for the primary care providers. So again, as I mentioned earlier about our integrated youth MIT services that's available for youth. And we're kind of first in the Bay Area to have this program, because our model is very different. I know UCSF offers something that, but they don't have integrated program with their pediatric unit. They're a standalone, but aside from them, there's nobody else provides this service except us and the county. And this is a really needed service right now, because the opiate addiction is really raging, and specifically related to fentanyl. Fentanyl is taking over the streets, not only here, but throughout the US. And this county, particularly, we're getting really hard in the section of the 12-year-olds to all the way to late 20s. So that's our biggest population that is going under fentanyl addiction or overdoses. So for that purpose, we have to create a specific clinic for you to treat. We also provide medication-assisted treatment services in the jails. So it used to be that nobody got treatment there if you were had addiction, or you were already in a treatment of methadone or Suboxone, or if you went to the jail, then you'd be tapered off. About 5-6 years ago, we said that was not okay, because it's like it's a chronic disease. So it's like if you have diabetes, they don't take any medication after you went to jail. So the same kind of mentality one here said, no, we will keep any patient that's going to jail, and we'll keep them there with ongoing care. So we provide all three medications inside the jail, and that's a very close coordination with the jail physicians. And again, we provide those methadone to them. We deliver them. The Suboxone is provided there inside the jail, primarily in the form of Sublocade, which is an injection form. Vivitrol is another injection form that's provided there, counseling. And then we obviously work with them on care coordination upon discharge. Point is that we are really getting across our system of care wherever we can to provide medication assisted treatment programs. So in a nutshell, that's who we are and what services we provide. I also want to put in a plug that our program also working very hard in the community by providing Narcan training and Narcan education. So that's another area that we are heavily involved in the community about education about dangers of opioids and providing prevention efforts by providing Narcan. Any questions? Any questions here?
I guess I may ask, if an adult were to have a nonprofit agency outpatient support team with a psychiatrist and clinicians already assigned, are they still able to utilize these county clinics, even though they technically have their own separate outpatient team connected to them already?
Yes, definitely we can, but they have to do that 50 minutes of it just one time with us.
Okay.
The rest they can be with whoever they're working with.
Okay.
But as I mentioned, Title IX is driving here.
Right.
So we have to stay with their boundaries, what they're allowing us to do. And that 50-minute once a month is a must for Title IX.
Yeah.
Any other questions from our audience?
If somebody has private insurance, like Kaiser or another private plan, and they're not able to connect with like family that it's underneath, would they be able to now still utilize these services with you guys?
You mentioned Kaiser. We do have a contract with Kaiser. So yeah, they send their patients to us. We also have a contract with Valley Health Plan. So they send patients to us. We also have a contract with VA. We get patients from them. So those are some of the contracts already in place, but if there's some other private person who wants to come in, we will try to work with them.
Thank you. Any questions from our online?
Hi, this is Bonnie here. I had a quick.
For youth
oh.
and adults with private insurance.
For youth. I believe Valley Health Plan covers youth, but VA does not. Well, I take it back. The VA covers anybody 18 and above, which is still technically the youth. And same as with Kaiser, but anybody that falls 18 and below will have to get a special authorization for that.
They also had asked, what is covered?
What is covered is the physician visit, all the physician visits. You can start with an assessment. Just like you do any other treatment, we go, the physician evaluates you and see which medication is best fit for you, depending number of criteria that they have to go through. And so you get started in a medication. And then after that, you come and all your dosages are covered. So you take, as I said, you have to come daily till you get the privileges to take medication home with you. So that's covered. Counseling is covered, case management is covered. The only thing that we don't cover, but insurances cover, is the transportation. If you don't have transportation, usually now the health plans provide transportation. So I know some of our patients are using that method because, as I said, this is the start of is a daily dose till you earn. So you do have to come to the clinic every day. Yeah, so counseling, physician, and medication, they're all covered under. They're using a benefit through their health plan.
And another question from Leo says, if patients do not have any type of insurance, can they get services?
Yes, we also provide a payment structure or in our ability to pay. We go through the financial counseling, they figure out like if you're can pay out of pocket, and so how much. If not, at times we have opted not to charge or charge very minimum depending on everybody's situation.
That from online.
Okay. And does anyone online have anything that they want to say?
Hi, this is Bonnie. I had a quick question. I kind of was a few minutes late, but to get services from MAT services, we will have to call the mental health helpline,
okay.
right?
All right. Oh, yes.
Do you guys, I.
How come they're not hearing me?
Slides and I'm not able to like see all the slides on here.
Hello?
Are you guys able to connect clients to, like detox and then residential treatment too? If just the medication and that is not enough?
Yes, we do provide services, injection with detox program and residential. So we actually take medication and deliver them to wherever they are. So yeah, if the outpatient service is not enough, they need higher level of care, which they can go to residential. We will continue our treatment with them, and we will actually do daily delivery to that site, wherever they might be.
How do you connect to that kind of thing? Like I've called with clients at the Wilson Center to get them into like a detox or residential, and it would be like, oh, we don't have a bed for another however long, for a long period of time. And by the time the bed would be available, they lost sleep, to get into like treatment. Is available basically now, or?
Well, if you want them to get started with us, they can just come and we call, as I said, call the gateway or call center number, or you can walk in any day through Monday through Thursday, and we will do assessment. And if they are deemed that they need to go residential, then once we admit them, then we work with the residential to get them a bed. And make that transfer happen.
Had up earlier.
Yeah.
What's the drop-in address? The drop.
Oh, the drop-in address is also on those, let me just go back on those,
Your screen again.
clinic. The Central Valley Clinic is, located at inside Valley Medical Center campus, 2425 Enbrook Lane in San Jose. The Alexian Health Clinic is on the east side of San Jose, 2101 Alexian Drive. And then our San Martin Clinic, our South County Clinic is located in San Martin, which is very close to Gilroy. And that address is 90 Highland Avenue in San Martin. And then on the North County, this is the slide that has the information on the clinics and the numbers to call. In the North County, BART treatment programs providing the services, and they're actually on VA campus in Menlo Park. So for residents of North County, that's the closest one they can go to.
Is there any way around it being where they have to go every day in? Because how there's the NEX van where they can help get them onto like Suboxone there and they can prescription. Is this part of that, or is this a different program?
The Suboxone could be in prescription program. Yeah.
Most of my clients, they're not able to like every day get themselves.
I know it's a hardship, but we can, if they need that first evaluation by the physicians, we can't say we can have to provide everybody with Suboxone. It may not be a good fit for them, but if it is, then yeah, it could be also done through prescription.
Another question online from Leo said, do you have an estimate on how much it will cost?
Oh, again, it depends on everybody's financial situation. But I mean, I have had people who were, who were really in like tight budget, like they're getting the Social Security or they were homeless, etc. They just pay $50 or even less, depending where they was. But then, we do have patients who are working and they're making good enough money, but our fees could go anywhere between, say, from 50 to 350, 400, 500, depending, but majority of people fall around 200, 250, at least the trend that we're seeing, the patients who are using this. But I know I have approved the payments for as low as 50 or less. Or then other ones, depending on, they have to meet with a financial counsel and they would determine how much they can afford to be part of that. Yeah.
And then the one from Bonnie said, so to get services, do they have to call the call center and ask for MAT services?
Yes, they do. And what right now our gateway or call center staff do, they take some information about the demographic, and that's to determine like which clinic would be best to connect them with. If somebody lives here, then we'll try to say, the closest one within 30-mile radius is this clinic, so we're going to transfer you to that clinic for your ongoing care. So they will make that warm handoff to us. They will send the caller to the appropriate clinic, and the clinic works with that patient to find the right time for them to give them an appointment.
I think that's about it for all my questions.
Any other questions?
Just if I may ask a quick summary. So it seems I've heard 3 to 4 clinics that were mentioned.
4.
Central Clinic, Alexa Clinic, San Martin Clinic, North Park Clinic. Hypothetically, in an emergency of severe withdrawal, they could walk in and request immediate services. Ideally, if it wasn't urgent, they would call Gateway or the call center to schedule some form of intake to get the assessment based on their location.
Correct. I mean, as I said, they can come in as a walk-in to our clinics.
Right.
Or they can call and make an appointment, or just bypass us altogether, just walk anytime in the emergency room.
Right.
And get the help, and then you get connected with ours after you get started on medication at the emergency room. Then your next visit would be with us for ongoing care.
Thank you.
Any other questions? And once again, for our Arlon people, any further questions?
Okay, well, thank you, everyone. Appreciate your interest in addiction medicine. Please send us your questions, connect with us, and some the patients that may need this service.
Okay, thank you so
Thank you.
much. So, and I'm so sorry we had some technical problems earlier, and so I apologize for that, but thank you so much. Lots of great information, lots of engagement, I think, and so we will be posting this video on our website. So if you guys want to come back, and we'll also be posting the slides as well, so that people can access them as well too.
The website.
Okay, so last opportunity for questions, and then we'll be signing off here. All right, well, thank you all. And then our next one is going to be June 14th. And sorry, it's going to be our supportive housing programs. That'll be talking about how to access their services as well too. All right, thank you, everyone.
Thank you.
Bye.
Bye. How do I get out of here?